Well, we're back with Dr. Zhitnitsky. Dr. Zhitnitsky, sometimes people like me and patients, we have a few missing teeth in our mouth. And sometimes we have them missing for quite a while. Usually they're in the back, because in the front we have a tendency to fix it a little faster since we look awful ugly with it. But nothing much seems to be happening, nothing bad, once those teeth are missing, a year, 2, 3. And yet, every dentist keeps telling us that having a missing tooth is devastating, is bad, you've got to fix it. Can you shed some light on it? What is this apparent discrepancy? We not really feeling any negative effect, and you saying that it is not a good thing.
It's very important to have your missing teeth replaced, because every tooth needs a contact. And if there's a missing tooth, then the back teeth, they start shifting forward, and the teeth that are facing that tooth will start shifting down or up, depends where the tooth is missing. And that can really mess up your bite and lead to problems with chewing and even problems with your jaw joints. It's a long-term process. It doesn't happen overnight, but it surely happens.
I see.
And so when it happens, when it happens, it's really much harder to get it fixed than to prevent it in the first place.
As it usually is with when things happen. So basically, what you're saying is, if a tooth is missing, it has nothing to the teeth which are still in it have nothing to lean on it, and then they start shifting and
they start migrating.
They start migrating. They start becoming like a broken fence. Looks like
Yes.
It looks ugly and doesn't do the function anymore on top of it.
It's not only, we're more concerned about the function than looking ugly.
Okay.
Because the function is more important. We use our mouth for a lot of things. We use it for speech, we use it for chewing, drinking. It's a very vital part of our body. So if it's not functioning well, people would be miserable.
Right, so basically, now we heard about the chewing part, and then you have, of course, people like me. When my wife eats one leaf of salad, I'm done with the steak and the salad. So obviously I don't chew too well, and I would, if you tell me you can't chew too well, I'd go, well, so what? I probably wouldn't chew anyway. But what other things are there? I've heard that when a tooth is missing, that the bones are shrinking. Is that true, and does it have any effect on, is that part of it? Give us a few other things of, what are the consequences of that function? Give us some effects which we can feel in life, but maybe not associate to having had missing teeth.
When there is a missing tooth, the jawbone atrophies also, because there is a special receptor in the tooth that keeps the jaw growing and regenerating itself. What happens is, like, if you don't exercise your muscle, it atrophies. Same thing with the jaw. So a missing tooth, for example, if you have a tooth missing for a very short period of time, there is a very, very strong jaw around it, and the doctor can place an implant and have that area restored. But if you let a lot of time go by, that ridge will shrink, and the jaw will shrink, and there'll be extra procedures necessary if you want to replace this tooth with an implant. It's not so much of a problem when you put in a partial denture or a bridge, but as far as everybody likes to restore teeth with implants nowadays, which is a very good solution, it would be more difficult to do so if you let it go for a long time.
I see. Okay.
Some people's jaws are so resorbed that when they get older and they need a full denture, which some people still do in this day and age, especially the bottom one, it doesn't have a lot of jaw to hold on to, and people really have a tough time using it.
Is that also when you lose this kind of bones in, probably three-dimensional direction, one way or the other way, and as more teeth missing, as easier it is probably happening, that then you start like looking a little, caved in and
yes, if you have missing teeth, a lot of the aesthetics of your face could be related to the way your teeth are positioned and the way your jaws correlate together. And that if you have missing teeth, you may have cheeks caved in. If your bite is over what we call over-closed, when it's closed more than it's supposed to, you might have a frown line instead of a smile line. There's a lot of different ways, and dentists, we can diagnose and then correct it.
And all that starting from missing teeth and misalignment. Now, if you made the example about a fence and it, it's all crooked and it doesn't function anymore, does that also mean, maybe the whole mouth is out of alignment, the hinges here? I'm a mechanical machinery guy, so I'm thinking here like, does that, from what you're saying, mean your mouth come out of alignments and maybe then you get, muscle tensions and stuff like that? Would that be also something which, because of it, comes from what you say?
The jaw joint is the most complicated joint in your body.
Really?
It rotates, it slides, it glides, it moves in 8 different directions. And it has a lot of blood vessels and nerves around it. So if it's not positioned correctly, and the way your jaw positioned is related to the way your teeth come together. So if it's not positioned correctly, it can lead to migraines, debilitating headaches, jaw ache, neck ache, back pain. In fact, there is a relatively new theory out now that the way your jaws relate to each other actually affects your posture, the way you sit, the way you walk, the way you read. And if you ever go out on the street, you can notice how different people with their jaws positioned in a different way actually have different postures.
Wow.
So again, everything is related. Your mouth is not independent of the rest of your body.
Well, I can definitely assume that when your joints in any area not working, that there will be pain. So for a person who has, let's just say, muscle tensions in the neck, lower shoulder, maybe some headache, and especially if he has some missing teeth, would it be wise for him to go to a dentist and look at it, that maybe because of the misalignment of the teeth, which happened most likely because of missing teeth, that it could be perhaps fixed and he could get rid of those daily discomforts?
Oh, absolutely, absolutely. In our office, we actually have a TENS unit that we hook up patients to that relaxes their jaw muscles and establishes their true bite, in which all their facial muscles are at rest. And in that position, the way they close their teeth, it doesn't stress the joints and it doesn't stress the muscles, and it relieves headaches, it relieves joint pains, it relieves backaches, migraines. It helps a lot of people. Wow. And the procedure is relatively easy and not invasive.
Absolutely wonderful. So it obviously it definitely looks that the mouth affects lots of areas, and the dentist, it looks to me like you almost you help looking better, not just because you have a nice smile, but the facial structure, the posture. You can maybe eliminate headaches and muscle pains, which obviously must be difficult to sleep with, difficult to work with. So let's, almost
You're absolutely right, Helmut. An old French philosopher said, "A man with a toothache is incapable of love."
Oh, wow. I can see why. Well, we're going to have a lot more to talk. I say goodbye for now. This was wonderful about missing teeth. Very insightful. Thank you very much.
Thank you, Helmut.